Hello everyone, my name is Julia and I'm a third year medical student at Queen Mary University of London. So my journey into medicine hasn't actually been straightforward. I did my GCSEs in 2012 and got my results that August. I then was able to progress into my A-levels and I got my results for my A-levels in August 2014. And unfortunately, with my A-levels, I was actually 2 marks off from the requirements that I needed to get into medicine when I first applied. So what that meant was I decided to do a detour and I did biochemistry as my first degree. And I also want to highlight that it's not uncommon for students to do 1 degree first and then do medicine afterwards as a second degree. So anyways, I completed my first degree in biochemistry from September 2014 to July 2017. It was one of the proudest moments of my life so far. And during my final year of biochemistry, that's when I applied to do medicine for the second time. Unfortunately, I did get in, and having graduated, I was able to start my medical degree program at Queen Mary University in September 2017. And now I am currently in third year of medicine, and it's definitely been an interesting journey so far, learning about the different aspects of medical care, as well as getting fully immersed within the medical team and really feeling part of the multidisciplinary team. So the team that works in the hospitals and GPs, and really being able to contribute to their discussions. I always get asked a lot of the time, why did I choose to study medicine? Why would you commit to something that is lifelong? And yes, the cliche reason was I want to help people. And this is a common reason that a lot of students give when they do apply for medicine or any healthcare subject. The trick is to make sure that you're as specific as possible regarding your reasons as to why you may want to do medicine. But for me, yes, I do want to help people, but it was because I was inspired by the healthcare that I received when I was younger, when I experienced a lot of different health problems, meaning that I was admitted to hospital or I had to see the GP on a frequent basis. I was truly inspired and in awe by the way all of the doctors and the healthcare professionals was able to contribute to delivering the best management and treatment plan for me. Also, I was able to volunteer at King's College Hospital for about 3 years, so quite a long time. And during that time, I was able to be in ward rounds. I was able to assist patients who had disabilities to help them feed and to help them eat during their lunch breaks and their dinner breaks. And it was a really good way to understand the hospital setting and medicine even more in that context. And another reason for why I wanted to do medicine was, yes, science and people makes a happy Julia. I do enjoy learning about science, so biology and chemistry. And then I also love working with people. And I feel that medicine was the best way for me to marry those 2 personal interests of mine together. And also within medicine, you're able to practice and also be one of the leaders of the team when it comes to the diagnosis of patients' illnesses, which is pretty cool. Even though I said, yes, you're a team leader, you are also a team member. All of the roles of the different healthcare specialists within a medical team, within a hospital or a GP, they're all as equally important. And then lastly, for me, what really sealed it was work experience. I cannot emphasize enough how important work experience is. Through that, I was able to see and experience firsthand what it was like in these different healthcare settings, and I could picture myself in the positions of the doctors that I saw. And so I always get asked as well, what do I hope to do in the future? Long story short, I don't know. I'm still currently undecided regarding what field I may want to pursue when I have graduated from my medical degree program. But what's amazing about medicine is that there is a large variety of options to choose from after graduating. You can go into a typical medical field such as cardiology, surgery, neuroscience, neurology, orthopedics, pediatrics. I know I'm saying big names, but don't worry. These are all names of different specialities within medicine relating to the heart, to the nervous system, to working with children, and so on. For me, I'm quite interested in medical education. And what that means is being able to teach younger medical students or healthcare students about different aspects of medicine. But this would be based on my personal interests, because it's always good for a doctor or a healthcare professor to be teaching medical students the field that they specialize in. So then, regarding my specialism that I'm interested in, I am interested in dermatology. And dermatology is the study of various skin conditions and the skin. So this can be things relating to eczema or even allergic reactions to different irritants. It can be anything like that, or even acne. Acne is a skin condition, and so as a dermatologist, I could be able to help people with skin conditions like that. And then lastly, I am also interested in sports exercise medicine. I know they're very, very different fields, and sports exercise medicine is where you practice medicine and treating patients based on sports related injuries. So depending on where I might practice in the future, I could become a personal doctor for, someone in the NBA. Why not? There's so many opportunities within that field too. I do hope that from my clinical placements, which are starting this year, in third year, that I'll be able to figure out which fields I will be pursuing. So hopefully you found my journey in medicine and my introduction helpful. Hopefully it also emphasizes that there isn't just one way to get into medicine. You can do medicine straight after sixth form or college, or you can do another degree and then do medicine, or you can take a gap year. There's so many different options to start the medical degree program. So what I've planned for you today is a subject taster, and this will be introducing a really important concept within medicine, but also generally within healthcare, and this is medical ethics. So first and foremost, what is medical ethics? Medical ethics is where you are presented with a problem, and this problem can be in the form of seeing a patient at a ward. It could be based in a discussion within the different team members in a ward round or within a GP. So you're given a problem that's going to be based on the patient's condition. And what you have to do is you need to work as a team, and you need to be able to decide the best course of action, what is going to be the best treatment plan, what is going to be the best management plan. And what makes medical ethics so interesting and also complex at times is ideally you would like to be presented with a problem whereby you are able to just determine the right from the wrong. Easy solution. However, medicine isn't always like that. Sometimes there could be two rights, and this, for example, could be the patient's view versus the doctor's view, or also a conflict of opinion within the medical team. And so using medical ethics would allow you to be able to come to a decisive conclusion about what is the best treatment and management plan for a patient. So learning about medical ethics is important because as a medical student and a doctor, you will encounter challenging scenarios. This is a given. For example, with organ transplants, they are limited. There aren't as many organ transplants needed compared to the number of people who are waiting for an organ transplant. So the question is, who gets the transplant first? And that's why we use medical ethics to be able to decide on these complex issues. Also, it's going to be an interview question or a scenario. And what I mean by that is during your application process, if you do decide to apply for medicine or any healthcare field, it will probably come up just to see how you are able to rationalize and come to a decision on simple and complex ethical scenarios. And lastly, it would allow you to understand differences of opinion. As a doctor or as a medical student, you're going to be working in a large team. And this team is going to be formed of people of different roles. And because of that, everyone may have slightly different training in some areas. There may be some specialists who may know more than you as a future medical student. And so it's useful to have medical ethics, so then everyone is able to come together, discuss their different opinions, and come to a conclusion. That's the main important thing. And so with medical ethics, there are 4 main pillars. Maybe you might know some of these. Don't worry if you don't know at all. This is an introduction, and the main thing I want from you to take from today is that you remember these 4 pillars. The first pillar is autonomy. And here I have a picture of a hand under an X-ray saying, okay. And what I mean by that is, autonomy is the right of an adult to make an informed decision. So they are okay and are happy with the decision that they are making about their own healthcare regarding their treatment and management plan. And here I've included the word competent adults. So a competent adult is someone who is able to make a decision for themselves because they have understood all the information that the clinician, the doctor, the healthcare professional has given to them. And so with competent adults, under law, an adult is age 16 and over. And this is because they have the capacity, they have the ability to consent, to agree or disagree, so to consent to treatment unless there is evidence to the contrary. So this ethical principle is emphasizing that a patient has the right to accept treatment and to refuse treatment. The responsibility of a doctor or a medical student is to ensure that the patient is fully informed of everything regarding a treatment or management plan. And a tricky question sometimes is, do children who are aged under the age of 16, do they always need parental permission for their treatment to go ahead? The answer, surprisingly to that, is no. A child or an adult under 16 does not actually need parental permission every single time for their treatment. The reason why is because of something known as Gillick competence. Gillick competence is a term used under medical law whereby an adult or a young child under the age of 16 is able to give consent should they have the capacity and the doctor or the healthcare professional has deemed that, yes, this child definitely has the capacity to understand what I am saying. And so in these instances, the parents may not actually be involved. An example of this could be with an underage teenage pregnancy. With this, if the patient, so if the young adult has the capacity and is understanding all the information that's being given to them, then they can make the decisions for themselves. But of course, this will be varying depending on the situation that any patient will be in and if there are any circumstances that could put the patient in danger. So first one, autonomy. Next one, beneficence. So here I have a picture of a scientist doing some work because doctors are not only clinicians and provide healthcare, we are also scientists and we have to make sure that our knowledge is up to date. So here with beneficence, this is the duty of medical practitioners to do good for their patients. So what that means is we want to ensure that we are providing the best quality care and best management plans for our patients. We do follow national guidelines, for example, NICE, and also things noted within the NHS and other medical governing bodies. But the important thing is that sometimes we may have to tailor the treatment and the management plan that we offer to patients because they could have varying abilities or they could have a disability. So we want to make sure that the treatment plan, the management plan that we offer is something that they are able to carry out independently. So with Beneficence, it's all about evaluating the benefits of the treatment versus the risk involved. And the reason why I mention risk involved is because a lot of things in medicine, there are risks. Even with a surgery, for example, there is the risk of complications. And so before a patient is deemed necessary to have surgery, the doctor needs to go over all of the benefits, but also the associated risks to, again, link into autonomy to come to their decision. And lastly, as mentioned, it requires medical practitioners to update their training. Medicine is always evolving. There are practices that we do now that weren't used 10, 15 years ago. And there are also practices that we used 5 years ago that aren't used now. And so it's really important for doctors and any healthcare professional to ensure that their knowledge within healthcare is up to date. Next one is non-maleficence. Here I have a picture of someone getting a cast around a fracture. With non-maleficence, it's the duty of medical practitioners to do no harm to their patients. So you could say this principle of non-maleficence is like the opposite of beneficence. And so important things to note about how harm can be caused. It can be caused by active harm, whereby you someone could inflict pain on someone else, or it could be by omission, which is by neglect. And so what we want to ensure is that doctors and healthcare professionals do not cause harm, and therefore there is non-maleficence. And again, it's all about evaluating the benefits and the risks associated towards the patient. And lastly, here we have justice. So here in the bottom right corner, I have a picture of, this logo is used quite a lot in the justice system, so in law. So I thought it'd be quite fitting. It's all about balance, and that's what this scale is depicting here. So with justice, this means to ensure that all actions taken are legal and that all patients have the same quality of care and the same access to treatment. And there are situations where this doesn't actually happen. And an example of that is known as the postcode lottery. If you haven't heard of what the postcode lottery is, this is where some treatments are offered in some areas based on their geographical location, and that same treatment may not be offered in other areas. An example of this that is quite well known is the accessibility of IVF, in vitro fertilization. And this is a form of treatment given to people who are trying to conceive a child but are finding extreme difficulty being able to do so naturally. And so the issue currently faced with IVF is that there is this postcode lottery whereby IVF is offered more in some areas within the UK and less in other areas. So how is it fair that someone living in one area compared to another area can have more accessibility? And this is where the justice principle comes in, to be able to ensure that all patients have a fair access to treatments available from the NHS. And as mentioned, it's all about the fair allocation of resources. So now here we're going to overview an example. And this example, as you may have seen in the news or on social media, is actually super important and it's relevant today. The example is, if a vaccination against COVID-19 came out, do you think it should be made compulsory? So as I read this question, you're probably thinking of some ideas already. And I am fairly certain that the ideas you're thinking of do relate to the medical ethics principles. So with situations like this, it's always helpful to break things down into those 4 principles that we've just covered. The first one is autonomy. So with autonomy, in relation to this scenario, patients have the right to choose what they accept and what they refuse regarding their healthcare. And so this same principle should also be applied if a vaccination against COVID-19 was also to come out. And also regarding autonomy, patients could refuse treatment because of religious or cultural reasons. And also there could generally be a fear of side effects or potential ineffectiveness. And so with that, that ties into the next principle of beneficence and also non-maleficence. You need to ensure that patients are well informed of the treatment, of the benefits and the risks associated with this vaccination. Regarding beneficence and non-maleficence, this vaccination could help reduce the spread of the virus, and it could help reduce the burden on the NHS to ensure that other illnesses that may not have been prioritised because of this pandemic are now able to be treated. Next thing is about herd immunity. And if you're not sure of what herd immunity is, this is whereby a large proportion of the population are immune to a disease or a virus. And this could be achieved either naturally or by vaccination. And the last thing is regarding non-maleficence, that you don't want to do harm. The opposite is that if someone was to turn down the vaccine, it could contribute to the spread, and therefore it could cause harm to those who do get ill because they could be immunocompromised, meaning they have a weakened immune system, or they could be under vulnerable patients. And the last principle is about justice. As mentioned, justice is to do with the fair allocation of resources. And so we would need to make sure that this COVID-19 vaccine is freely available and accessible by all, regardless of location. And so here, the reason why, as mentioned, that ethical issues in medicine and using the pillars is important is because it can come up anywhere. And so question for you, what ethical issues can you think of are present in medicine? As I read this question, you have probably thought of some answers already. So some scenarios involving medical ethics. Here, I've got a long list, but I'm only going to focus on a few. For example, treatment of patients with self-inflicted disease. For example, if you have a patient that abuses alcohol and has already had 2 liver transplants, the question is, do you give them a third? Another ethical scenario to consider is the withdrawal of ventilation in a dying patient. And this obviously ties in with whether a patient is conscious, whether they're unconscious, if they're in a coma, how long, all of those things. And with this scenario in particular, it's always important to involve the next of kin, so to involve the family members or whoever would be the next person of contact after the patient. And other scenarios that I want to focus on is clinical trials. We want to make sure that clinical trials are conducted as safely as possible. But as you can imagine, clinical trials are all about the development of something, the development of a drug, of an antibiotic, of a medicine, of a vaccine. And so you want to ensure that the risks associated with the development of this medicine is as small as possible. But it does involve animals and humans. So that is where medical ethics comes into hand and is super important there. And then lastly here, should doctors ever go on strike? This is a very important scenario, and it has actually come up within the last 10 years about the junior doctor strike, if you haven't heard. And so all of these scenarios here, they involve medical ethics to varying degrees. And so what's important is to be able to have the discussion with the relevant team members in the healthcare field to be able to come to a decision. And so if you want to find out more, I have compiled a list of resources for which you can do your own research. So here, these are some organisations and resources that you can access. The Medical School Council and the General Medical Council are 2 important governing medical bodies within the medicine field. And so you can do some research into medical ethics here. And I've also noted from the MSc, there are outreach and support programs available for you to look out for as well. The BMA is the British Medical Association, and they have some toolkits for you to check out. And also, social media is actually quite helpful. There are some really good Instagram and YouTube channels, and I want to highlight 2 of these here that I even used now, and also that I share to current students who are applying from year 13. And if you want to find out about other medical ethical issues, you can look at these sources here. And I want to highlight the podcasts. Podcasts are becoming quite popular nowadays. And so here you can check out Second Opinion, which is a really good series of mini podcasts based on different things. For example, is it normal for a doctor to have a gut feeling, and how would they be able to analyze this gut feeling to be able to provide the best treatment and management plan for a patient? So it's really interesting medical ethical scenarios and ideas to think about. And here you can also check out things on the NHS website, newspaper articles, and other things there. So in summary, hopefully you remember these 4 pictures and what they all mean. These are the 4 main pillars of ethics, and this is what I want for you to take away from today. And so if you do have any questions, you can actually find me on QMUL Unibuddy. And just want to say thank you all for listening. I hope you found this session, this subject taster session in medicine, super useful.